Did you know that almost 1 in 3 Americans do not realize they have diabetes or prediabetes? Millions of lives are being affected by this silent pandemic, which is frequently concealed by mild warning indications. It's not simply useful to know the top 7 early signs of diabetes. Preventing potentially fatal consequences, including kidney failure, nerve damage, even heart disease, is vital. Ignoring these symptoms could be detrimental to your health, even though they may initially appear to be harmless. Are you prepared to discover the unexpected messages your body is frantically attempting to convey? Stay still, because you might actually save your life if you catch these early. Polyuria comes first. The constant need to urinate more frequently than usual is known as polyuria. Furthermore, it's more than a small annoyance. It's one of the first and most important indicators that diabetes is secretly destroying your body. Your kidneys are unable to reabsorb all of the extra glucose when blood sugar levels surpass the kidney's threshold, which is around 180 milligrams per deciliter. Urine is the means by which they eliminate it. Urine volume increases dramatically as a result, often reaching 3 to 4 L daily, double or even triple the typical amount. What makes this a warning sign? Your body becomes dangerously dehydrated when you lose a lot of fluid, which thickens your blood and puts additional strain on your heart and blood vessels. Serious consequences like heart disease and stroke can result from this strain's contribution to high blood pressure and increasing vascular damage. Your kidneys are under a lot of strain, which raises your chance of diabetic neuropathy, which is one of the main causes of kidney failure in the US. However, the negative consequences of polyuria don't end there. Your sleep cycle is disturbed by the persistent need to urinate, particularly if you wake up several times during the night. This can lead to a compromised immune system, chronic weariness, and cognitive decline, all of which can significantly reduce your quality of life. Additionally, polyuria results in harmful imbalances in essential electrolytes like potassium and sodium, which can induce lightheadedness, cramping in the muscles, and even irregular heartbeats. Because it can be confused with a urinary tract infection or just excessive water intake, this symptom frequently goes unnoticed. In actuality, though, it is your body's desperate cry for assistance. Continued glucose and fluid loss exacerbates insulin resistance and raises HbA1c levels by about 2 to 3% if left unchecked, increasing the chance of major side effects such as retinopathy, neuropathy, and other organ damage linked to diabetes. Polyuria is a suspicious but important sign because of the modest progression. Early detection can make the difference between successfully controlling diabetes and suffering irreparable harm. Are you experiencing more frequent urination than usual? Don't write it off as typical. It's a loud warning from your body. Before it's too late, pay close attention, because you might lose your life and your health if you wait. Polydipsia comes in second. Polydipsia, or that insatiable, overwhelming thirst that simply won't go away, is more than just a minor irritation. Many people dangerously ignore one of the first warning signals of diabetes. This isn't your typical thirst on a hot day or after working out. It's a strong, insatiable thirst that can lead someone to consume multiple liters of water every day without ever feeling fully content. Over 37 million Americans suffer with diabetes, and polydipsia is a serious warning indication that your body's ability to regulate blood sugar is seriously weakening. Severe dehydration results from glucose flooding into your urine when blood sugar levels spike, frequently exceeding 180 mg/dl. This process, known as osmotic diuresis, drags water along with it. You experience more than just dryness as a result of this dehydration. Though it can never fully catch up, it puts your brain's thirst center into overdrive, making you want to drink more and more. Why is this important? Because polydipsia-induced dehydration thickens blood, your heart must work harder to prevent high blood pressure and vascular damage. This unrelenting fluid loss might eventually overwhelm your kidneys, hastening the development of diabetic neuropathy, a condition in which your body's toxic waste builds up and kidney function declines. Furthermore, insulin resistance is exacerbated by the cycle of dehydration and elevated blood sugar, which makes it more difficult for your body to use insulin efficiently. Your HbA1c levels may rise by as much as 2 to 3% as a result, significantly raising your risk of serious side effects like heart disease, nerve damage, and vision loss. However, the effects extend beyond your organs. Frequent urination and persistent thirst frequently interfere with sleep, which can lead to chronic exhaustion, irritation, and weakened immunity, which makes you more susceptible to diseases. Many people ignore this symptom as just being thirsty, but that kind of thinking is dangerous. Your metabolism is experiencing a covert crisis that needs immediate intervention. In essence, polydipsia is your body's smoke alarm going off. Ignoring it could result in a devastating organ fire. It can change everything if this symptom is identified early. Impartial harm may be avoided or slowed down with prompt blood sugar control. Therefore, don't disregard it if you find yourself caught in this cycle of unquenchable hunger. Before diabetes fully takes over, this could be the most important early warning indicator. Are you paying attention to the urgent messages your body is attempting to convey to you? 3. Inexplicable weight reduction. Inexplicable loss of weight. At first, that sounds fantastic, doesn't it? However, what if I told you that despite eating properly or even more, losing weight is actually a serious warning flag that you should not ignore? Your cells are starving for energy because high blood sugar prevents glucose from entering them, causing this perplexing symptom. In order to survive, your body starts breaking down its own muscle and fat rather than burning sugar. This weight loss isn't your typical kind. It serves as a silent warning that your metabolism is out of control. Up to 30% of persons with undiagnosed type 1 diabetes experience this abrupt weight loss, according to research. Why is this important? Because it indicates that your cells aren't receiving the nutrition they require, which poses a major risk to your heart and muscles. And the harm doesn't end there. By upsetting fluid and electrolyte balance, this hazardous procedure increases the risk of dehydration and diabetic ketoacidosis, a fatal condition in which the blood is flooded with acidic ketones. Many people ignore this symptom, attributing it to stress or changes in lifestyle. Ignoring it, however, allows diabetes to progress covertly and cause long-term damage. It's important to keep an eye out for any patterns that may accompany unexpected weight loss, such as extreme thirst, frequent urination, and hazy vision. This quick loss goes beyond appearances. It indicates that the energy system in your body is collapsing. According to studies, it is associated with elevated HbA1c values, which indicate inadequate blood sugar regulation and the potential for major consequences such as heart disease, kidney failure, and nerve damage. If you catch this early, you may be able to preserve your muscle mass, regain your equilibrium, and prevent permanent harm. If nothing is done, this catabolic disarray leads to weakness, frailty, and an increased risk of falls, particularly in elderly persons. Therefore, don't ignore it if you or someone you know is suddenly dropping weight. It's your body's cries for assistance. Testing your blood sugar right away could save your life. Think of this symptom as a warning siren that time is running out and insulin is failing. Being aware of this can enable you to take quick action, get medical attention, and avoid disastrous outcomes. Recall that one of the most important early indicators of diabetes is unexplained weight loss. recognize it, comprehend it, and act before it's too late. The fourth is exhaustion. Fatigue is more than just ordinary exhaustion. It's a clear warning sign that anything major may be amiss within your body. Your energy output drastically decreases when your cells are deprived of glucose, which is your primary energy source, due to a decrease in insulin sensitivity. Imagine that no matter how much you sleep, your body's power source gradually shuts down, leaving you exhausted. According to studies, between 50 and 60% of those with early-stage diabetes experience this constant weariness. However, the majority are unaware that it is connected to their blood sugar issue. Why is this so important? Because feeling drowsy isn't the only aspect of this weariness. It indicates that your body is having trouble converting food into usable energy at the cellular level. Every area of your body is affected by this energy crisis, which causes you to think more slowly, lose strength, and make daily chores into tiresome struggles. The threat that is concealed. This energy deficit raises blood sugar levels, which causes harmful oxidative stress and inflammation all over your body. This exacerbates insulin resistance, damages your cells even more, and keeps you caught in a vicious cycle of exhaustion and elevated blood sugar. Even worse, weariness prompts many people reduce their physical activity, which paradoxically exacerbates insulin resistance and blood sugar surges, increasing the risk to your heart and vascular health. The cunning aspect is that fatigue is frequently disregarded or misinterpreted as stress, melancholy, or just aging, which delays the diagnosis of diabetes and permits major consequences to develop covertly. Persistent fatigue indicates elevated HbA1c levels, indicating a decline in blood sugar regulation, increasing the risk of kidney damage, nerve discomfort, and eye issues. When chronic fatigue persists, your muscles deteriorate, wounds take longer to heal, and infections strike more forcefully. It goes beyond the physical. Anxiety and sadness are exacerbated by chronic fatigue, which keeps you in a risky cycle where it seems difficult to manage your health. Early detection of this symptom may offer you the opportunity to prevent diabetes from permanently stealing your health and vitality. Your body's urgent SOS is fatigue. Ignoring it puts you at danger for more than simply fatigue. Your quality of life is under danger. It's important to pay serious attention if you're feeling overtaken by unexplainable fatigue. Is it possible that diabetes is subtly affecting you and is only waiting for you to act before it's too late? 5. Vision blur. Blurred eyesight is more than simply a small irritation. Your body is sending a quiet warning that something is very wrong. Blood sugar spikes cause fluid to move behind the lens of your eyes, changing its shape and making it difficult to concentrate. This explains why vision problems are reported by roughly 33% of individuals with diabetes in its early stages. Here's the catch, though. This is not a random symptom. It indicates that your body is becoming less adept at controlling blood sugar, which raises your HbA1c levels and is associated with more serious issues. It can be confusing and even dangerous when images are blurry and indistinct due to swelling inside the lens, which can occasionally change during the day. Diabetic retinopathy, a disorder in which the small blood vessels in your retina weaken, leak, and ultimately result in scar tissue or aberrant vessel growth, is indicated by this fluctuating vision. This can result in blindness or irreversible vision loss if ignored. The part that's frightening. A lot of individuals disregard hazy vision because they think it's just eye strain. In actuality, though, it's the first obvious indication that blood vessels are disintegrating not only in your eyes, but also throughout your body. Heart disease, kidney failure, and neurological issues are all made more likely by this injury. The impacts are invisible. In addition to impairing balance and coordination, blurred vision increases the risk of falls and accidents, particularly for older persons. Anxiety and sadness can be brought on psychologically by the frustration of blurred vision, which makes managing diabetes even more difficult. This symptom is a serious warning sign since it may indicate systemic vascular damage brought on by consistently high blood sugar levels, which statistically doubles the risk of cardiovascular disease. Ignoring these early visual alterations can cause severe damage and delay necessary therapy. Your body is yelling for assistance if you notice that your vision is becoming blurry or erratic. It's not just your eyes playing games. Tight blood sugar management and early detection can save your general health and vision. Before it's too late, take action. A series of issues could be hiding beneath the surface, with your vision as being the first casualty. Sixth, gradual healing of wounds. Frequent infections and slow-healing wounds may appear to be minor, innocuous problems, but for people with early-stage diabetes, they are serious warning signs that require your undivided care. Your body's natural repair system suffers greatly when blood sugar levels are high for an extended period of time. This occurs because white blood cells, which are in charge of warding off infections, are severely hampered by high glucose. These immune fighters become lethargic and ineffectual, which permits infections to grow unchecked and wounds to stubbornly remain open. In fact, research shows that the risk of developing infections, such as respiratory, urinary tract, and skin infections, is doubled for those with diabetes. Why is it important that you know this? Slow-healing wounds can develop into severe consequences in addition to being uncomfortable. Small wounds or scratches that usually heal in a few days can take weeks or even months to heal, becoming havens for dangerous bacteria and fungi. Even worse, diabetes' poor circulation makes it more difficult for oxygen and nutrients to reach damaged tissues, which significantly slows the healing process. Because of this vicious cycle, even minor wounds have the potential to quickly develop into cellulitis, abscesses, or persistent ulcers. It is concerning to learn that 15% of diabetics get foot ulcers, which frequently begin as these invisible, slowly healing sores. As a clear reminder of how serious these early symptoms can be, many of these ulcers progress to the point where they require amputation. Furthermore, poor healing weakens the skins and mucous membranes, which makes infections more severe and long-lasting and frequently results in expensive medical care and protracted illness. Because these infections have the ability to spread systemically and raise the danger of sepsis, a potentially fatal illness, the stakes are considerably higher. The root cause, this symptom frequently indicates that your blood sugar regulation is failing and that silent harm is occurring to your skin as well as to your nervous and circulatory systems. If left untreated, this might worsen the risk of heart disease or lead to chronic kidney infections. Do not dismiss yourself if you are dealing with persistent illnesses or wounds that are refusing to heal. This is the urgent SOS for your body. To avoid long-term harm, chronic pain, or hospitalization, prompt treatment is essential. Measures like closely monitoring blood sugar, taking good care of your skin, and often checking your body for injuries might be the difference between recuperation and catastrophic damage. Peripheral neuropathy is number 7. Peripheral neuropathy, which causes tingling or numbness in the hands and feet, is one of the subtle early signs of diabetes that most people ignore until it gets worse. It's not just an odd sensation. Your nerves are yelling for assistance in a quiet voice. High blood sugar reduces blood flow and causes inflammation, which harms the sensitive nerve fibers. Additionally, between 20 and 30% of individuals with prediabetes or early diabetes have this early nerve injury. Why should you pay attention and sit up? Because these feelings frequently signal the start of a more serious issue. The messages your body sends are misinterpreted when nerves begin to misfire, which can cause severe searing pains, numbness, or chronic tingling, especially in your hands and feet. In addition to being uncomfortable, this is a sign that something is wrong with your neurological system. Ignoring these symptoms might lead to severe nerve loss, which makes you susceptible to injuries without even being aware of it because you won't be able to feel them. Imagine stepping on something sharp while barefoot and painlessly. With severe neuropathy, there is a genuine danger of sores, infections, and ultimately ulcers. According to studies, 15% of diabetic individuals have foot ulcers that are directly related to nerve damage, and untreated peripheral neuropathy significantly increases the risk of lower limb amputations and foot ulcers. Physical discomfort is just one aspect of the harm. Particularly in older adults, this nerve loss can significantly impair balance and coordination, raising the risk of falls. In addition to the hands and feet, neuropathy can affect the autonomic nerves that regulate digestion, bladder control, and heart rate, which can result in a host of other health problems that subtly lower your quality of life. The subtle way this illness appears only heightens its threat. Early tingling is sometimes written off as fatigue or poor circulation and can feel like pins and needles or a slight numbness. However, behind the surface, this is an obvious indication that your blood sugar is subtly undermining your nervous system. Research indicates that deteriorating neuron injury and decreased nerve regeneration ability are linked to impaired insulin sensitivity and persistently elevated glucose levels. These symptoms worsen and become persistent, excruciating, and occasionally irreversible if prompt action is not taken. It is crucial to detect peripheral neuropathy as soon as possible. Nerve damage can be slowed or even partially reversed with the help of some drugs, lifestyle changes, including regular exercise, and proper blood sugar management. Ignoring tingling or numbness puts one at risk for mental distress, physical injury, and a major impairment in day-to-day functioning. Now that you are aware of the top 7 early signs of diabetes, pay attention to what your body is telling you. Your best defense against major difficulties is early detection. Please hit the like button, subscribe for more life-saving health advice, and forward this video to someone who needs to hear it right now if you found it useful. Your well-being cannot wait. Take action right away to prevent diabetes.